impactful.
Okay.
So I got an elliptical during the start of the pandemic, which was great, and it broke within a year. And like trying to get it fixed was a mess. Like they sent me a whole like section unit of it, and they're like, "Here, fix this yourself." And I was like, "Okay, I could do this." Couldn't do it. I spent hours. And I finally called them. I was so mad. And they're like, "Oh, we can have a technician come out in like 6 weeks." And I was like, "No." So I bought a Peloton.
Wow.
So I bought the bike, and it's been great. Like I didn't think I would like it because I didn't think I would like having an instructor on the screen. I love it, and it's like you can like turn it onto a setting so you just like watch TV while you ride, or there's like little games things that you can play.
Oh,
So
cool.
I really like it. Yeah, there's a lot of options other than just like taking the classes, but there's so many classes and like so many genres of music and instructors and like figuring out who you like. And so yeah, I love it. So it's been good when I actually use it. But
Yeah.
So I have a Peloton and I never use it.
You have one?
I had to cancel the membership because I'm guilty paying like $40 and not riding at all.
I know. It's been a bit.
I might sell it.
Okay. Okay. Let me let people in. All right. Good morning, Dr. Kanan. I see you.
Good morning. Pardon all the moving boxes in the background.
Totally fine. So welcome everybody to our webinar today. First of all, I would like to welcome all of our guests today. Our guest speaker today, Dr. Andrea Kanan. She's a gynecologist. And we have Dr. Nelson. He is an emergency medicine specialist. And we have Dr. Lei Yu. She's a interventional radiologist specialist. And we have Dr. Annalise Bosco. She's a neurologist. We also have Dr. Leon Nguyen, but he's unfortunately is not able to join us today because he got stuck with admissions. So he would be able to join us later if he can. So just a few items, just to show respect to our guests today. Please turn on your camera if you can, and mute your microphone, so that we be able to participate visually with each other. So for our program today, we'll have about roughly an hour 15 minutes. First of all, we'll have our experts, our guest speakers, do a brief introductions about themselves and their experience. So anybody would like to start?
I can start.
Thank you, Dr. Nguyen.
Sure. My name's Andrea Canaan. I am an obstetrician gynecologist. I used to work in the same clinic as Dr. Nguyen, but recently moved to Maine, up in the northeast corner of the United States. And I was a faculty member at the Creighton University School of Medicine in the Department of Obstetrics and Gynecology. So I helped out with residency applications and interviews and everything along those lines, in addition to teaching medical students and residents.
Thank you, Dr. Nguyen. We are honored to have you.
All right, I will go next. My name is Lei Yu. I'm a assistant professor at the University of Nebraska Medical Center. My specialty is interventional radiology. I do have a little bit international background. I grew up in China. I did all my education up to college in China, and then moved to US for medical school. That's where I met Christina, we're classmates. And afterwards, I chose radiology as my specialty. I did the training, 5 years at UMC, and then additional interventional radiology fellowship training at UMC, and stay as faculty. So I do deal with a lot of medical students, and kind of helping them guiding their career choice, and helping out with their application process. So happy to chat with you guys.
Thank you, Dr. Yu. We're super honored to have you as well.
I can go next. Hi, I'm Dr. Bosco. I'm a neurologist. I grew up in Omaha, did medical school at UNMC. I completed neurology residency at University of Iowa Hospitals and Clinics. I should say I went to medical school with Dr. Nguyen. That's how we met each other. And then right now I am an assistant professor for Creighton University, on faculty there. I have residents and medical students working with me every day, and I've been helping students recently in this last year with their applications for residency and writing letters for them. And then every year I help with our residency interview process. So I'm happy to be here.
Wonderful. Thank you, Dr. Bosco. And we have our lovely Dr. Nelson.
Yes, I'll go last. Hey, Dalton Nelson. I am from small town Nebraska. I went to medical school at UNMC and was classmates with Dr. Nguyen, Bosco, and you. So we have some history there. And then I stayed there for residency for emergency medicine. I completed an ultrasound fellowship, and then I stayed on as faculty at UNMC. Currently an assistant residency program director, and oversee ultrasound education for medical students, residents, fellows, and faculty. So we are currently in the midst of interview season for emergency medicine, and I've completed 30 plus interviews out of 200 for the season. So I'm well versed in what it takes to have a successful interview for emergency medicine anyway, which is a little bit different than some specialties, but happy to meet you guys and chat with you more.
Thank you to all of our guest speakers today. So just a little bit of background. We have our audience today. They are Vietnamese doctors and medical students in Vietnam. Some of them are in Vietnam, some of them are in the US, and they are interested in learning more about the process of matching into a residency program in the US. Some of them are in the beginning stages, some of them are in the process of interviewing. So they are very excited and eager to learn. And this is a wonderful opportunity for them to hear from people from a variety of different specialties and with a lot of experience working with US residency application process. So this is an amazing opportunity that you are giving them. So thank you for that. And for our next part, we'll talk a little bit about how you view, how do you feel in terms of the changes with our interviewing process now, with the Zoom interview versus before, when we were going through the residency application process. We have to do that in person. And what do you see is positive aspect of that, and what are some of the challenges of that as well? So feel free to chime in whenever you want to.
Sure, I'll go first. Yeah, so when all of us interviewed, it was all in person, which was fun because you got to go travel, you got to eat some good food and drink some good beverages, which is always a good experience. I know some specialties moved away from the Zoom interface and are actually interviewing in person. As far as emergency medicine goes, we were kind of, our governing bodies essentially said you can do in-person interviews if you would like. However, I think there's a lot of advantages to Zoom interviews, mostly being cost. It's very expensive to travel around the country and interview at places and pay for a hotel, sometimes pay for a flight. So we initially had thought about doing like a hybrid where we'd have some in-person, some Zoom. But we're also aware that there's some bias associated with that, as far as, oh, you flew to Omaha to see us, you must be more interested than someone who just took a Zoom interview, which is obviously not true, because there's finances and a bunch of things that play into your ability to travel to a place. So we elected to do only Zoom interviews, and I probably will until it's more common that places and other specialties are offering in person. So I think Zoom is great from a financial standpoint because it is cheaper to do it that way. The downside to that is I think it's hard sometimes to really get a good feel for a program over the internet and over Zoom. So sometimes that's a struggle of, you don't get to go see the city. If you have a family, you may not get that feel for what that looks like, and just kind of the layout of the city and what that means for you. So I think there's pluses and minuses to Zoom, but for the foreseeable future, that's kind of our plan, with the then intent to do what we call a second look. So after interview season, you can come to UNMC or to Omaha or whatever city that you're interviewing for and see the city, maybe meet some of the residents, meet some of the faculty, tour the hospital. But again, not required in something that we look at as far as, oh, you move up in our rank list if you came for a second look. No, not at all. We don't use it for that reason. We use it so that you have an opportunity to come and see us, see our program, get a better feel, figure out if this is the right fit for you. So again, I think there's good things and bad things about our current format. I'm not sure what other specialties are necessarily doing as far as the Zoom versus in-person interviews, but that's kind of what we're doing currently at UNMC for emergency medicine.
Thank you, Dr. Nelson.
Yeah, we're doing the same thing. We're still on Zoom. I think all neurology programs are still doing Zoom interviews, and like, yeah, it saves money, but I prefer the in-person meet and greets. I think, as a student applying, it's so important to meet the other residents and get a good feel for like how happy they are or how burned out they are. And can you see yourself being friends with these people? Because you're going to be working like 24-hour shifts with them. And that's really hard to do on Zoom. It's really hard to get a feel for that. And so I think that's unfortunate, but it's also nice that you're not, paying to fly to like 10 different cities and stay in 10 different hotels, and that gets super expensive too. So there's a lot of pluses and minuses. I hope that maybe a couple of years down the road, we'll go back to in-person interviews. And as an interviewer, I think it's just kind of, it's tough to tell on Zoom, how is a person's bedside manner going to be? And you get more of a feel for that, I think, when you're in person and chatting with someone face to face.
Yeah, I would add to it. Oh, sorry, Christina. I'd add to what Annalise said too. We have socials that the residents and the applicants can go to either the night after their interview or before, because we do Thursday, Friday interviews. It's just hard to get to know anyone. Like, it's hard to know people over a social where it's like you're in a room full of people you don't know and you're talking on Zoom, which is even more awkward. Whereas when we interviewed, I don't know if this is true for other specialties, we'd have a social gathering the night before the interview or after, where you'd go to a resident's house or you'd go to a restaurant or a bar and have food and drinks, and like you could actually interact with the residents. And like Dr. Bosco said, of like, hey, I could work with these people, or like they seem really unhappy, like maybe I don't want to come here. So that's really hard to do. We do our best over Zoom, but that's as good as we've gotten right now. So.
Mhm.
All right,
Thank
so
you,
I'm just
Dr.
gonna chime
Bosco.
in a little bit about our program. So yeah, like everybody's said, like majority of format is still Zoom. For a lot of reasons, I do think you give applicants a lot of options for them to explore programs. Like you like initially they might be restrained by financial reasons. And also it's more convenient. A lot of people can take that money day off, go on interval trail. But the downside it is like it's hard to within like a Zoom interview to kind of figure out people's personality or like the true personality and interaction with people, which is very important for us to choose a resident in the future, or for the resident to feel like they fit in the program. But in the foreseeing future, I think we're probably gonna keep this format. And so I mean, Root interview has a lot of advantage for international applicants, because I do think our IMGs tend to apply to more programs. I do think that is a better financially. So that way, you don't have to spend a lot of money on the interview trial, and give you more opportunity to expose to more program.
Thank you, Dr. Yu.
So I was waiting for everybody to talk, but basically I would mirror everything that everybody's already said about the pros and cons that have already been spoken. I think the in-person interview definitely gives you a better opportunity to get a feel of people's personalities and the program's personality and the program director's personality and everything like that. But the definite advantage is that, less financial commitment, less time commitment. I remember driving to St. Louis from Omaha 2 different times for 2 different interviews that could have saved me a good 24 hours of driving about. So maybe not 24. Yeah, about 24. And so that was a lot of time commitment and money commitment. And then also you will find that there's a lot of people who applied to more residency programs because of Zoom and being more convenient to interview at multiple places. When I was going through, and this was just the nature of, I think, when I went through my residency interviews, but I only ended up going to 7 interviews, and I have medical students telling me about how they have 30 interviews lined up. So it's a definite change in the number of interviews that people are doing. And I think programs might be offering more interviews because they can potentially offer more interview days, although that also is a little bit hard logistically as well. So the spots are the same, regardless of how many extra interviews you have.
Right. Yeah, I can thank you, Dr. Kanan. I can definitely see how that could be beneficial, but it could also be more difficult for the program to make decision and in the screening process as well. Do you have any thoughts on that in terms of how what's the difference in Zoom interview in terms of your thought process and helping you to make a selection for the program?
As far as selection goes, I'm not sure that I find any specific differences. I know that when Dr. Nelson was talking about like the socials and stuff, I think, you know, our interactions between the residents and the candidates definitely has a big impact, because we want to make sure that we're going to have new residents that will mesh well with the current residents. And so having that ability to communicate. And so even if you are in these Zoom rooms that are really awkward and very annoying sometimes, I think making sure that you're asking questions and you know, showing your interest in the field that you want to go into and potentially the location where you're interviewing. I mean, I wouldn't recommend interviewing anywhere that you wouldn't want to be. Just kind of a waste of everybody's time. But in general, I think the Zoom part of it, making sure that you're interacting with everybody is important. So being active, being obviously on your camera, not having distractions around you as much as possible. So all of those things, trying to find a good place that you can be when you're in your Zoom. You know, we all have things that happen, and we all have crazy lives, and we all have things that, you know, I'm in a room that has a bunch of moving boxes right now and dogs running around, and you know, we have those things happen, but as much as you can, try and find some place that's going to be as calm as possible when you are in the Zoom, so that you can really engage with the people who are interviewing you and socializing with you if you're in one of those social events.
Yeah. Thank you. Dr. Nelson and Dr. Bosco, any thoughts on that?
Yeah, I think similar to Dr. Nguyen was talking about, there are the benefits and pros and cons of what we talked about interviewing on Zoom. We do a really like holistic approach to people's applications, where we look at a lot of things. Like obviously everyone knows like boards are important. Like you need to pass them, you need to do somewhat well, you need to prove that like you can study and take a test. But when we review applications, we look at a lot of other things. We have a whole like breakdown and spreadsheet that's like really complicated and complex. But we want to know, what are your life experiences? What things did you have to overcome in order to get where you are? Because that's super important. Like, right, like resiliency. Like you need to prove that you can face adversity and still overcome that. So we look at all of that, and we score everyone's application before we get it. So we do a very thorough screening. So, for example, I mean, emergency medicine is a little bit different because the numbers are down from a lot of what it used to be, especially last year. So COVID kind of ruined a lot of things for a lot of reasons, but especially emergency medicine, a lot of less people are interested in that. So we look and we target specifically geographic locations. So like places that are well known to Nebraska, medical schools that are known to Nebraska, places that rotate with us when they do audition or away rotations. So we kind of filter set up when we review applications as far as that goes too. But again, we look, do you speak another language? Again, what adversity did you face to get to where you are? What obstacles did you overcome? Yes, boards, scores, rotations, grades, and all that, like that factors in. But we truly look at the entire application itself, because we understand like not everyone's a good test taker, and your board scores might be a little bit lower. So we really try to figure out like, how do we get the best well-rounded applicant that we can get when we look. So not only do we filter you there when we're looking at applications, so like we had 530 applications for 12 residency spots. So we're going to interview 200 of those people. So that's a whole lot of work to go through all those applications and figure out which of the 520 do we interview. So it's sometimes trying to figure out like, how do you stand out and whatnot. And I think later talk more about like the actual interview itself, which I'm happy to chat about too. But really, it's hard because, as mentioned, like everyone's applying to multiple programs that maybe they didn't apply to in the past, because it's harder to come across on Zoom as an applicant. And like, I don't know, I feel like I would not interview well on Zoom, and I don't interview well in person because I get really nervous and anxious. But even to do that more so on Zoom is super hard. So like, yeah, trying to figure that out. But but knowing that like your application, someone's looked at, they reviewed it really well, is complicated and stressful. But again, like when we're looking for applicants, we're really screening the process, screening the application itself before offering an interview. So if we're interviewing you, we clearly like you for a reason. So it's sometimes hard to remember that as an applicant too, is like, hey, you've done all the work, you've done the hard stuff, now just chat with us and get to know you as much as you can over Zoom. So
yeah, I think our process is similar. We don't necessarily have a board score cut off, as long as you've like passed boards. I recently learned that like one of the smartest doctors I've ever worked with failed step 1 the first time they took it because they're just not a very good test taker. But clinically they're like a genius. And so we try not to have like a hard board score cutoff, but we do pay a lot of attention to letters of recommendation, looking to see if someone is like teachable and a good learner. Because sometimes you can be very good at, studying books, but maybe you can't pick up on things clinically, or, it's a little bit different doing bedside teaching rather than, learning from a book. And then, I mean, during our interview process, we're really just seeing like, are you a nice, normal person? Like, can you have like a normal conversation? And neurology tends to attract a lot of nerds. And so a lot of us are kind of socially awkward, but you don't want to be like too socially awkward. So like just making sure that you can have like a nice normal conversation, and get along well with people. I mean, that's really one of the main things we're looking for on the interview trail, is like, just, are you nice and conversational? Because those are some of the main things that's going to translate over to having a good bedside manner.
Yeah, that's great insight. Thank you, Dr. Bosco.
So kind of echo everybody have said. I think we do not emphasize only on board score or like what on paper. I think but there will be a certain level, because I think there is certain correlation of how well you study and how much score you are. It's not the most important metrics we look at. But for our specialty, now it's getting very, very popular and it's super competitive. So we do look at a certain score. But if you have a outstanding, that's great. If you do not have a great one, but you're very competitive, or if you have a lower than expected score, I mean, things happen. It could be sick or have some major stressor in life when the period of time you take the test. I think have a good explanation and have other aspect of like hard stuff, like can prove you actually has a good learning ability or experiences. I would think that would be helpful. Like with some of our candidates, if they have a super low, this won't matter in the future because there's no step 1 anymore. But just for example, if you have a super low step 1, but they make up with a super awesome step 2, and they have explanation, and then not avoid talking about it. Like they will say, okay, I know my step 1 or my particular score is super low. But that's for what reason, and I prove my ability of learning. And so that's just an example for if you have a super low score, but otherwise you're really good packet and you worry about that, would be the reason people not giving you an interview, or the reason you are not gonna be able to match your program. Just make sure you have an explanation for that. And after the interview, like everybody else said, really it's how you interact on interview. I think Zoom is a little bit awkward in the format because you're literally talking to a computer and screen. It is not, that easy. Even for interviewer like us, it's not easy to kind of show our true extent of our personality. But I do think we still catch up people's personality. We catch up people's unique quality over Zoom interview. just because people's interview skill or Zoom skill progress over time. So if you're not a good Zoomer, make sure you practice many times, with your family, with your friend, just kind of practice how you adjust your eye, where you look at, how your body language, how your backdrop, and, stuff like that. Pay attention to. But I do think interview is more to looking for as yourself. How are you going to fit in the program? How are you going to be, taking care of a patient? How you interact with in general in person, like for us, it's like nurses, techs, or other specialties. I think that's extremely important. And those quantity we can pick up during even the interview.
Yes, thank you very much. Now for the next part, we're going to talk about some of the common mistakes that you've seen applicants had during your interview with them. And I think this will be very helpful for our audience because we always want to avoid mistake that we can.
I'll go ahead and go. So I think it's kind of been alluded to a little bit, but seeming like you're not interested is a big thing. And that's really hard over a Zoom interview. So if I'm interviewing you and you're like constantly looking off to the side or like potentially looking at your phone or something else, like that's not good. So it's really hard because I mean, when we interview, we do 9 15-minute interviews for each applicant, which is a lot. So it's really hard to be engaged for that long, even if you are super interested. So I would say showing interest, making sure you know about the program that you're interviewing at, and you don't have to know it like detail wise, know some things about it, especially if you're interested in a certain area of your specialty, whether like for us, whether if you're ultrasound interested or you're critical care interested, like knowing that you've researched our program to say, oh, you have people trained in these areas that I'm interested in, ask questions about that area, ask questions about the fellowship you're interested in, but showing that you've at least reviewed the program a little bit and know something about it is always good. I go a little bit back and forth on this. You will get asked at some point, what questions do you have for me about our program? Which I always hated as an applicant because sometimes I didn't have questions. Some people are very offended if you do not have a question to ask them. I personally am not. I don't care if you have questions. Like I'm happy to answer them, but like if you have all your questions answered, I don't expect you to make something up or re-ask a question. But some programs will, some people you're interviewing with will want you to have a question prepared. So have a common list of questions you ask every program. Tell me about your proudest thing about your program. Tell me about where you see your program going in 5 years. What's one of the biggest weaknesses of your program? Like having those questions, because I think you learn a lot about a program for some of those things of like, hey, yeah, our biggest weakness is our residents hate our program. Okay, we probably don't want to come here. But knowing some of those things to ask, and they don't have to be very specific, they can be very generalized, but having questions to ask is important. Again, not for me, because I don't care if you have a question or not. But that is one thing that I've universally hear some of my colleagues will be like, well, I asked if they had questions and they didn't have questions. So clearly they're not interested. No, not true. But some people will perceive it that way. So just being aware of that. But doing your homework on the program, knowing some things about them, seeming interested when you're interviewing, I think are the major things I've seen where people have kind of screwed up a little bit. And then this has been talked about a little bit too. If you have something on your application that looks bad, whether that's you failed step once, twice, whatever, you failed a rotation. Emergency medicine is a little bit different. I don't know about their specialties, but we do away rotations where you get a standardized letter of recommendation that you never see. But hopefully someone's talked to you about it, because sometimes there's things in those letters that can be bad or seem bad that you should be able to talk about. So if you have a letter of rec that says, this person doesn't pick up on social cues very well, or like they don't seem very teachable, or whatever the case, being able to defend that and explain it in a like way that doesn't upset or anger you, and having a really good explanation for some of the things. So if there's a part of your application that isn't outstanding, like being able to defend that a little bit in a very professional way is important too. Because maybe like I think Dr. Yu said, sometimes you take step one and you're sick, or a family member's sick, or something major in your life happens, and being able to explain why maybe you didn't perform at the level you expected to, or that you normally perform at is important as well. So.
I would echo a lot of what Dr. Nelson said, but also I think one really good question to ask programs, so you can put this on your list, is what kind of changes do you see happening in the next, 3 to 5 years? And, that one can tell you a lot about where that program is going and where that department is going. And, most of the time people will tell you positive things. But at the same time, if there is something happening that's a little bit bigger, they should hopefully be honest with you and tell you about that as well. So I think those are all really good things to think about. And then being engaged, kind of like what I already said before.
Yeah, I think being engaged is, you can express how important it is. The worst interview experiences we have, and it's not like, oh, I feel this way. It's like across the board, all the interviewer on that day feel the same way. It's like this applicant seems like he just didn't care about our program. Just feel like he would rather to be at somewhere else than interviewing with us. The interview session is about, for us, it's about 15 to 20 minutes. Sometimes can be feel like short when you have a very, very engaged conversation. Sometimes can be painfully long. If you are talking to somebody, you ask a question and there's literally one sentence answer and there's no back and forth conversation. And I do not think that disengagement will be, I don't think like being quiet or introvert interviewer will be equal as disengaged. I think that's a myth. I think you can be quiet, you can be introvert, you can be not like bubbly, not like super, across the board, but you will pursue yourself as a very interesting interview like applicant. If you prepare for the interview, you show respect and you do prepare questions you genuinely want to know about the program and how the program is going to prepare you to success in the future. I think you will be seen as you're genuinely interested in. So if you not showing respect, looking somewhere else, like if I ask you a question, you just give me one sentence answer and there's no follow-up. And like if I feel awkward sitting there staring at my screen and feel like it's a terrible day, I'm not talking, it's terrible. So don't be that person. And that doesn't mean faking yourself, doesn't mean like you being overly engaged, like promising like, oh, your program is so good, your program is like my dream program. I don't think over promising or showing like exaggerated or way more emphasize interest in your program is a way of approach it either, because that will seen as that will be seen as like what's that word? Be honest, like not faking your feelings for the program just to please them. Because end of all, we want to match your resident who will actually fit in our program. We want you to succeed, but also we want our program to succeed as well. So it is a mutual selection. Another thing I would say, pay a little bit attention to, your gestures, like showing engagement, not like laying back in the chair, like Dr. Nelson said, like looking around. Don't have your cat or dog running in the background. Make sure you are an area without distraction. Make sure your backdrop is not super distracting. So like I remember have a applicant, his backdrop is just like super flowery with it's a male interviewer. Like I just keep my eyes cannot be moving away from that backdrop. So don't get those to get away from, also like try to make sure you're, that's in general, probably not applying to any of you guys, like no kind of like political stuff in the background or like super religious stuff. Just try to be neutral, trying to be a clean trying to be a professional environment. Those can be catch up as first impression of you. Some of our applicant will put a notebook or put like a textbook of IR in the background. It's like, oh yeah, I noticed that note like a textbook. Do you like that one? I like that one. So yeah, it's kind of interesting. But anyway, I think a mistake is it's kind of we summarize like trying to avoid disengagement. Another thing is trying to respect, because the interviewer will be sometimes will be attending, sometimes will be resident, sometimes will be our coordinator. Make sure she'll respect to everybody. Don't only show respect, oh yeah, you are the program director, you know, I'm super engaged with you, and you are just like a resident or like coordinator, and then just like, oh, you know, doesn't matter. Make sure you respect everybody, because everybody on that table have a stake in saying of the interview.
Yeah, those are all really good points. I agree with everything Dr. Yu said and everybody else. The only other thing I could think to add for like a common mistake is, like in the last 2 years, I've interviewed a lot of IMGs, and every year there's at least one person who seems like they're really nice and really smart, but I cannot understand their accent. So it might be a good idea, if you're not a native English speaker, to have a conversation with someone who doesn't know any Vietnamese, and just make sure and kind of double check that you're easily understandable, because I've had that problem with people from different parts of the world where unfortunately their English was just not quite fluent enough, and I just had a really hard time with their accent.
Someone just had a comment or a question about whether or not they could use a blurred background. I think it all depends on the device you're using and what is available. But if your device does allow you to have a blurred background, I don't see why that's a problem. You know, it's a very common thing on Zoom, so I don't know that it's an issue. I wouldn't find it to be a problem.
Yeah, to say if you have ability to do a blurred background because you don't want whatever's behind you showing is great. But like Dr. Yu said, sometimes it is nice to have a staged background as in a very well done way, as far as not being distracting, but potentially showing off some of your interests. Like if you're a photographer or you paint, like having one of your paintings in the background, that's again not distracting, but like that's a conversation piece as well, especially like, oh, my hobby is I take photography, or I take pictures, or I paint, or I fish, or something that you have that's in your life in the background, is, as far as again not being distracting, but says a little something about you, is great. But if you don't have a great background, doing a blurred thing, if you can, I think is great. But it all depends on what you're trying to portray and kind of show off to the interviewers and stuff too. So
I think Dr. Nelson makes a good point, because I have in many interviews made comments about someone's painting in the background, and it was something that either they did or their family member did or something like that. And so that helps that 20-minute conversation continue to happen, you know, even if you don't have questions or we don't have questions or anything. Just getting that normal, natural conversation going is very helpful. So like Dr. Yu said, keeping it so that you're not having these awkward silences, and that 20 minutes seems like 3 hours.
Yeah, I think also another thing is like always prepare something personal, not regarding just study or just the program. Like we really enjoy meeting people with different life experiences. Like if you have, you know, a recent trip, pretty, you know, interesting, or if you have, you know, some unique hobby, I think that's all stuff to talk about. I think for interview for us to meeting all the applicants, even though we only match one person per year, but we meet so many applicants. It just really, really good experiences to know there are so many outstanding applicants out there, and to get to know their personality. Because even though they don't get to match with us, like they might be future colleagues we'll meet in the future, like, you know, 5 years later, we might see them in a meeting, presenting and stuff like that. So it's good just to, you know, show you and get to know everybody. like I have a recent applicant, he's from Chicago area. I was like, oh yeah, do you have any recommendations? I'm bringing my son to Chicago this weekend. So a lot of the conversation was actually about Chicago, but over that conversation exchange, like I can say, oh, this guy actually know the area really well. He can actually give you recommendations or give you advices in life. Like you obviously know he's pretty smart based on his score, but he is a person when people around need advice or need suggestion, either resident or attending, they go to him and he will convey a conversation and just give you the suggestions. So I think that will pick up some quantity of the applicant. So not necessarily about how many papers you publish, how many hours working in the lab, or how good you are at reading article and stuff like that. So yeah, paper sound like a unique conversation. Not have to be unique, just conversation about yourself.
Those are wonderful advice. Thank you very much. And I totally agree, having a personality is very important, because board score is it's very similar, because we all have a certain scores, and then clinical experience, there are certain clinical experience, but we definitely want to make sure that the person is somebody we can work with and enjoy our time with. Just like Dr. Bosco said, 24-hour call, we have to be able to connect with that person to some level. So in terms of the general application process, besides the interviewing, do you have any advice for our audience?
I think for general, like building your application for residency, I think this has been touched on a little bit today, but talking about how you have overcome obstacles, not necessarily shying away from talking about things that have happened, but how you learn from those experiences and how it's going to shape you to be a better physician is important. So learning, because we like as a program to see, or when I was with Creighton, seeing how people can learn from difficult situations and how people can grow and make kind of changes to their perspective on things, and just kind of be a person that is able to move and change with whatever situation happens.
Yeah, and to add to that, I would say, for us to get a good idea of how you are as a learner, I would suggest that you try to get letters of recommendation from people that you worked with for a long time, even if they might not be in the specialty that you're applying for. But if you can get a letter of recommendation for someone that you worked with, off and on for like 6 months or a year, that's a lot more important to me than, someone who you rotated with for like 1 week. So if you could get letters from people who know you well and have seen you grow professionally, I think those are also really helpful.
Yeah, definitely agree with that. I think that when I'm looking through an application, some of the really important things I look at, as mentioned, is overcoming adversity, obstacles in life, good letters. Again, it's always nice to know, like, you can do well in a specialty that you don't want to go into. You showed interest, you were really great, they liked you, which is always good to know, because it's like every specialty has a different personality, and if you can interact well with other specialties, that's always good, especially for a specialty that consults everyone in the hospital for all the things. So being able to call and talk to somebody on the phone is super important. But things I really look at that I think are important are, what is your involvement outside of just studying? What groups have you been involved with? What associations are you involved with? Do you have leadership positions? Are you president, vice president, treasurer, secretary of whatever group that you're in? And I think that shows a little bit more that you're not just a member of something, you've done the next step. And honestly, I think one thing that I think is overlooked is former employment. Is, have you had a job before? Have you ever had to work and have a job outside of going to school? Obviously not realistic for everyone. Like that's not always going to happen. But if you had a job and did well, whether you were a patient care tech or a CNA or a phlebotomist and everything else, it's like, can you show that you've done a job and done it well for more than a week or whatever? So I think that's something we often look at is what do you do other than I sit down and study and take a test? Because I think that again shows some resiliency and some things about your personality that maybe you don't pick up on otherwise. So I think it's really important to talk about those things in your application and list those things. And I think, Dr. you maybe talked about hobbies, like list what you do for fun. Like that's important to us. Like usually I feel like a lot of specialties have very cliche things that they like enjoy doing, but maybe you have something really unique that you do that like I don't know anything about. Like put that on your application, because that's a conversation starter, something to talk about other than just like, hey, medicine, cool, you like that, great. Because I don't know, again, I don't know other specialties, but a lot of our interviews are getting to know you. And I think this has been alluded to a little bit of like, cool, I've looked at your application, I know you're a good applicant, that's why we are interviewing you. But I want to know, like, are you going to blend and mesh well with the other residents in our program? Do you seem like you fit in? And honestly, a lot of that goes into how we put you in our rank list of like, yeah, you scored so well on boards, but you're also kind of weird. Maybe you're not going to fit in well here. Like, and sometimes people score really well on boards and are not weird. But sometimes there are things that correlate that we want to know about. But yeah, again, just trying to make yourself the best well-rounded applicant and really show off what you can do other than just medicine, I think is important.
Yeah, I would also add, if you have any cool or unique hobbies, please talk about that. That really helps to remember people and will really help you stand out. Like one of the applicants I remember the most was like, I forget the term. He was like a falconer or something. He would like train birds of prey, and he like had a picture of him walking around with like a huge bird on his arm. But stuff like that is cool and unique, and we want to know, like, if you have interests outside of the hospital and that you're well-rounded.
I think even if you don't have like a unique falconer type hobby, just talking about your hobbies is good. And then talking about how your hobbies help you be a more well-rounded person, how it can help you stay well throughout your career, or throughout whatever it is that you're pursuing. Because I can't say that I have any like really unique hobbies, but I like to do baking and hiking, and those are things that help me relax and focus when I'm back on the job. And so like talking about those things can help you make sure that you're showing the program that you know how to find that harmony between work and life. And I mean, it's not really something that anybody ever truly, I think, finds a perfect balance of, but I think that knowing that you have strategies in place going forward is a good idea.
One thing is, I think, can I emphasize is if you have anything stated in your application, make sure you have a backup story. So don't be like, oh, like I love movies, and then when we talk to you about what a movie you like, or some like a really easy conversation about movie, and like you cannot name like 1 or 2 recent movies, you have the same. Or if you say like, okay, I like hiking, and I would say, oh, tell me recent hiking trips, and you cannot name one or cannot extend the story. So then that will be a really, really big no. Like one of our faculty had to interview somebody who said he's like, oh, he's into Brazilian Jiu-Jitsu. And this faculty actually is practicing Jiu-Jitsu as well. So laterally telling him about some like, basic moves and stuff about this, applicant has no idea. So don't put anything unique or cool on your application, but something like you actually cannot back up. Because if you put something on your application, those conversations will bring up, like we will identify, oh yeah, I'm gonna talk about this. Because imagine we have interview with so many different people. For us, it is a task to identify something in your application, like we can talk about, because it's easier for us. Like we're running out of topics to talk to with applicants as well. So make sure anything put on there, you'll have a story to back up. Yeah, and don't lie. Don't lie about anything. That's a big no for any sort of application or interview. Be honest.
Yeah, I would echo what Dr. Yu says. Like that happens often where people will say either they had an experience like, oh, I volunteered for this place, and you ask them about it and they can't talk about it. It's like, cool, you probably went to the soup kitchen one time and like that was it, but you whatever. Or like oftentimes we see people say, oh, I speak this language. And then we have interviewers that speak that language as well. And they're like, okay, let's have a conversation in the language, and they can't speak it. So like, don't lie, as Dr. Yu said, like, cool, if you understand basic Spanish and can say a few words, great, probably not something you should on your application. Like I can say words in Spanish and comprehend. Can I speak Spanish? Not well. So I would never say I have basic Spanish skills or whatever. So, but yeah, if you have experiences, hobbies, you have to be able to have a conversation about that, or it'll very much be apparent that that's probably not something that's true or that you're super passionate about or have a lot of experience with. So just, yeah, if you have something in your application, make sure that's something you can have a conversation or back up 100%.
Okay. So we do have a lot of questions from our audience during the registration process that audience has submitted. So I would like to go through a few of them. I know that our time is limited. So one of the member asks, is there a preference between MD student versus DO student versus IMG student?
I don't think there's any preference between MD and DO, at least at the Creighton's. As at Creighton, we have MD and DO students all the time. And then as far as IMGs, one of my residency classmates was an IMG from the Dominican Republic. And then I think this year there's a few IMGs that are being interviewed as well. So I think it all just depends on the program, but the Creighton OBGYN program is open to all of those.
Yeah, I think it's very dependent on the program and the specialty. For us, like MDs and DOs are viewed the same by the younger attendings and colleagues. There are some older attendings that I think still have that mindset that like MDs and DOs aren't the same, which is completely wrong. We view them as the same. Like sometimes our classes that we match are half DO, half MD. So don't care about that. Same with IMGs. Like personally, I don't view them differently. The sometimes issue with IMGs is visa status, because there are some hospitals and institutions that cannot sponsor a certain visa. Because I think J1 visas are oftentimes sponsored by hospitals, or our hospital anyway. And there's some other variations of that. I'm not going to pretend to know anything about that otherwise. But sometimes the visa that you're able to obtain or have affects whether the hospital system can hire you. And you guys probably know way more about that than I do. But sometimes that's the limiting factor is we have so many, like we have a ton of great IMG applicants that we can't interview because our hospital does not allow us to hire them. So that's always something to be aware of whatever visa status you have, of whether or not the institution you're applying to supports that and logistically can support you. But no, it's like we interview IMGs often. The one, again, if we can hire them in the future, but that's the rate limiting step for a lot of it is, can we support the visa that you have? Currently, we have a third-year resident who's from Ireland, and she did pediatrics for a couple of years and then transitioned to emergency medicine. But even with her, like having been in the United States for a while, she had to go back and renew her visa. And when she went to Ireland, there's a chance that she wouldn't have been allowed back out of the country, the United States. So that's a risk, because then we lose a resident. Like we have a whole resident now that we don't have a spot for. So that's always a risk that we have to consider. But again, I don't think it should deter you, but being aware, I think, of what programs are supportive and accepting of IMGs versus DOs, whatever, is important. And sometimes it's hard to tell on the website or whatever, but maybe chatting with other people that have interviewed there, or if you have friends that have interviewed, kind of knowing what their policy or what their kind of approach is to IMGs is important.
Yeah, I think you can probably get a good feel just by looking at programs' websites and looking at their current residents and see, you know, are current residents a good mix of MDs, DOs, and IMGs?
That's a great tip.
I think also emailing the program coordinator to ask those types of questions as well. There's nothing wrong with communicating with programs, just to kind of get some background too, because there may be programs. I mean, I think even though we've hired or KHOİN has hired IMGs in the past, like our current residents don't really reflect that. And so knowing that, you know, is that something that the program's open to, I think is important. And then asking about the visa information as well.
And just to piggyback on what Dr. Kanan said, not only emailing about that, but if you've applied to a program you're super interested in and you haven't heard back from them, and it's like at some point you should have been offered an interview, follow up and send an email, either the program coordinator or the program director, and say, hey, I'm very interested in your program, and this is why I would love to interview here. Because sometimes your application gets overlooked for whatever reason, whether it was maybe a board score or geographical something, whatever. So it's okay to reach out and try to make those connections. Otherwise, apart from through Eris or whatever website, I know OB has switched from Eris, they're no longer using that, which I understand why. But it's okay to reach out and clarify and ask questions. And again, especially if you're super interested in a program and you have a connection to that program, whether it's regional or whatever, just like reach out and talk to somebody, send an email, and the worst they can say is no. But maybe you can offer an interview after your email. So I think it's important to follow up and try to reach out if you're not getting the information you need or the answers that you need. So.
Yeah, coordinators are a very great resources. Like sometimes the program directors will be too busy with clinical duty, and also they don't always have the applicant's information or at a computer. So coordinator, that's their job. They are very good with communicating, and they actually know the program way better than a lot of people. So definitely any question, reach out. And if you not getting initial offering of interview, don't lose hope, because there's always people dropping out of interview later on in their path. So just make sure you tell them, say, hey, can you waitlist me if anybody drop off, or if there any position opening, would you consider me? I'm very interested in your program. Always reach out.
And I just want to say that I actually have to hop off of our Zoom meeting, but just thanks to everybody for having me here.
Thank you so much, Dr. Bosco. Have a good day.
Dr. Nguyen, in the chat, someone asked, may I know the prerequisites for IMG to apply for residency program? I guess I don't necessarily know some of that, but I honestly don't think it's that much different than anyone else applying to a residency program, apart from, again, going back to the visa status and knowing whether or not that program supports the visa you may have. I don't know, Christina, you may be able to speak more on that, but I don't know the details regarding that for as far as prereqs go for applying to a program in the US. But
I mean, I think that some of the basics are just making sure you have all your steps done. And I mean, but that's true for medical graduates from the US as well. So I think it's important to make connections as much as possible. So I know Dr. Nguyen has had a few people come through and do some clinical shadowing with her. I know I've hosted one of those former, well, she was a doctor, but if you can and have the ability, I know it's not possible for everybody, but making some sort of connection, either virtually or in person, really helps people learn who you are and what you are, how you are as a person, before going into residency, interviews and stuff too. But I know that that's not super accessible for every single person. So.
Yeah, that's a great point.
Sorry,
go ahead, Dr. Nelson.
I was gonna say, figure out where people in the past from your medical schools have gone too. Like that's helpful. Like obviously if they were accepted to a program or they got interviewed somewhere, they're probably very accepting of IMGs. So like being aware of what that pipeline looks like and being able to access that it would be super important, because that's going to take some of the hard work off of you of knowing like, hey, this program accepts IMGs without issue, whatever. Just makes your life a little bit easier. So if you can access that of where prior graduates have gone and trained or work at, again, making those connections, super important.
There also a great point that Dr. Nguyen brought up in making connections. So I just want to ask if you have any tips for IMGs in finding US clinical experiences, whether it's paid or free, or is there any opportunities at your institutions that would allow the IMG to shadow or follow you, observe?
I wish I had a better answer to this, but honestly, I don't know for sure. Again, I think that goes a little bit back to like, where have prior graduates, prior people in your institution gone? And I think a lot of it's going to end up being just reaching out, emailing, calling, talking to people to see what opportunities are available. I think sometimes there's institutional policies that either prevent or allow that to happen. So I think there's a lot of hoops to jump through, I think, to make that happen too, with all of the forms as far as HIPAA and whatever else goes. And like, you can't actually touch a patient because you're not employed here, whatever, that sort of stuff. So I don't have a great answer. I don't know if others do as far as that. I've not actually experienced that myself as far as setting that up. I've definitely had learners from other countries come, mostly China, but UNMC has a really good relationship with that hospital. So I don't know if Dr. Yu or Can know more than I do, because I don't know very much at all about that topic. So
yeah,
I don't really know much. Yeah.
Oh, sorry. You go ahead first.
Well, I was just gonna, I don't really know much other than the fact that Dr. Nguyen had some people and she, asked whether or not I could have them with me, and I said yes. So that's all.
Yeah, I think a lot of a website for the program or the hospital, they will have position for externalship. I mean, there's like official and unofficial, right? Like the shadowing a day or two versus like you're doing a formal rotation. And it's quite different. So I think a lot of hospital and program that will have, if you want to do a formal interview, not formal interview, formal rotation, they have the externalship on their website, like a way of process, and then those, I would say majority were required, it's paid rotation, but there are some like very free or for international graduates. As for our program, and also it's program dependent. I cannot speak for other program. For our program, I think we don't have a formal program set up. I mean, we're international like interventional radiology, so it's not a super popular one amongst IMGs. But radiology is another one we host like under our department that we have interest from IMGs. So I would say we don't actually have a rotation requirement program on our website. The best way to do is gonna be reach out to the coordinator for medical student, and then they will reach out to the GME office in the hospital and looking for policies. And so, yeah, I would just ask if there's information on the website, that's great. If not, if there's any places that you are particularly interested, potentially either it's a place that will land you interview or potentially position in the future, and reach out to the hospital, reach out to the program.
And we have time for one or two more questions. So one of the most common asked questions is the language skills. So Dr. Bosco mentioned that a little bit earlier. So we have a lot of people who can speak English, and what are your view in terms of their accent, and how does having English as the second language would influence or affect your ability to present yourself across in your application in general, and as well as in the interviewing process.
Yeah, so I can speak a little bit for that just because I am international in background and I do myself have an accent. I think accent is not something important, but you do need to be able to communicate, because end of all, what are you doing? We're not only looking at an interview, right? We're not looking about application because that's the first step, but our ultimate goal is for patient care, for safe patient care, for team communication. And language is just a tool of important tool for communication. So I do think that's something you need to master before, you know, consider being a physician in US. And not necessarily like I have to be like a perfect in English, but certainly you have to be able to do in like a meaningful communication and able to have our, you know, understand our patients or how our patient understands you. Important to do effective communication from team members. That's something I would say very, very basic. And if you determine to be become a physician or becoming to finish get the training, medical training in US, I think that's a hard area you will have to be working on really, really hard. Yeah, and I will say if somebody applicant during interview, if we could not understand really well, I mean, we understand everybody will have accent, but if we cannot understand or they don't have enough English, you know, communication language skill, I would say that will pose a very negative impression on the applicant. So I think that's very important.
Yeah, I think obviously, Dr. Yu can speak to that way more than I can. But when we're interviewing someone, again, if you can't have meaningful communication and interaction, that does become very difficult. And sometimes, again, that comes back to like, has this program had a lot of international medical grads and stuff too, because then maybe they're more used to accommodating some of that stuff. And sometimes you always have to think about patient population. Like you come to Nebraska, like most people are like white boys that speak English and that's about it, and they're very conservative. So you have to like understand that like they may have a harder time talking to someone with an accent or someone who doesn't communicate English super well, as opposed to like New York City, where they're very used to people who maybe have accents and a little bit less English proficiency. But again, having accents and not having perfect English is not a deal breaker. I mean, we would take an applicant 100%. If again, they don't have perfect English, if they can communicate, as Dr. Yu said, have a meaningful conversation, provide safe patient care, are the biggest things. And sometimes that's hard to get in a Zoom interview because you get nervous, and communication sometimes struggles when you do speak English. So that can be a little bit difficult, but yeah, making sure that you have a proficiency that allows you to provide patient care at the safest level is the most important thing.
And I think like what Dr. Bosco said earlier, practice having conversations with someone who, you know, someone other than your Vietnamese friends who also speak English in the same way that you speak English, because you may understand each other very easily. And so having conversations or, you know, getting in touch with people who are English speakers is a good idea too. And I'm going to have to jump off. So thank you, everybody.
Thank you so much, Dr. Nguyen.
Yeah. Have good luck.
There's a question about research, whether that's important or not. I think that very much depends on the program you're applying to. I think some specialties like you to have research, particularly if it's research in the area that you're applying to is important. I would say overall for emergency medicine, we don't care if you have research or not. I will say if it's something you're passionate about and something that you really care about, and especially if it's related to the specialty you're applying for, wonderful. Like, and you can talk about it like we said before. If you can't talk about your research, not that important. But if it's something very relatable to the specialty you're applying in or something that you're very passionate about, 100%, that's important. But again, that's going to be very specialty dependent. particularly, I think, more for surgical specialties. They much appreciate that you have research. Again, it's going to depend on the program. It's going to depend on the specialty that you're applying to.
Yeah, I agree. I think that just shows it just shows extra efforts or extra interest you are in the specialty if you have research. Also through research experiences that can show your way of like how you deal with people, how you interact with people. I think it's a plus. It's not absolutely necessary. It's but certainly will be a plus. But if you that's saying like you have a positive research experiences, like right, if you have research project but then you really don't know about it, you just put on your paper to pop up your CV, and then we actually talk to you about the research project, but you cannot have more language than what I have. So then I think that will be posed as a negative for you. So if you have research, you put on your CV, make sure it's something you really have a lot of knowledge on, and it's something you can talk about, not just to pop the CV. Yeah.
All right. Thank you so much. Sorry about that. Henry and Nathan just came in. So, thank you so much, Dr. Nelson and Dr. Yu, as well as Dr. Bosco and Dr. Kanan, for sharing your time and insight with us today. It's been a wonderful experience learning from you and hearing about all of your wonderful and amazing work. We have a person in the audience who asked about whether we could share this recording today so that they can rewatch it. And I just want to ask to make sure that is allowed by our guest speakers today.
Yeah, definitely.
Yeah, no problem.
And then Dr. Nguyen, there was one more question. I'll just quickly answer it if that's okay.
Yeah, of course.
They're asking, they work in an emergency department, if they want to apply for family medicine or internal medicine in the future, is it possible? Can you clarify, are you a physician working in the emergency department, or what is your role working in the emergency department right now?
I was working as emergency physician.
Okay. Yeah. So it would be easier, the fact that you haven't done a U.S. residency, I assume, to apply for family or internal medicine. They should have no issue with that. And honestly, your background working as a physician already in an emergency department probably looks wonderful to people who want to interview you. So I don't think that would be an issue at all, applying to internal or family medicine in the future. So.
Thank you.
Okay. Yeah. Thank you, everybody, for joining us today. Our time is up. So if you would be able to turn on your camera and we can take a photo together. And then in the chat, you also see a link that we do ask that if you can take a minute or so after the event to fill out. That's a survey feedback form for us so that we will be able to provide even more helpful and useful webinar and information for you in the future. So if you can take a minute to fill out the survey form for us, that would be wonderful. I really appreciate that. And this feedback form will also have some helpful information that we could share to our guest speaker as well, to show them our appreciation and our thoughts about what they shared today as well. So if you can take some time to do that, that would be wonderful. Okay, and we'll take a quick photo here. If you can send some, if you feel like the information provided today has been helpful for you, please send a heart to our speaker today, Cam.
And also, Dr. Nguyen, if anyone in particular is going into emergency medicine, they can feel free to reach out to you and I can communicate with them if they have questions specific to emergency medicine. So I'm happy to answer further questions in the future if you have them as well. So.
Thank you so much, Dr. Nelson, for offering that. If you have any question about emergency medicine or in general about residency, please feel free to send us questions and I can help to connect you with Dr. Nelson. Okay. Thank you, everybody. And okay, we'll just take a quick photo and okay. 1, 2, 3. All right. Okay. So our event today has come to an end. Thank you everybody for joining us. Thank you, Dr. Nelson, again. Wish you have a wonderful weekend, as much of a weekend as possible. And goodbye, everybody.